Hello.
All right, hello everybody. It's Dr. Alex Earl here, and it's Hump Day with Dr. Alex Earl. We're here at Pure Plastic Surgery today, and we're going to go over your plastic surgery topics and, of course, answer all of your questions. All right. So today, I thought it'd be interesting to go over all the possible procedures that you may or may not need after your weight loss journey. So, of course, weight loss is something that is becoming more, like we see more and more of it today because of the injectables, okay? Specifically, the Ozempic and the Mounjaro. I mean, these drugs have hit the market and they've just gone like crazy, like buck wild. And the thing is that they work. And so people have been losing lots and lots of weight with these injectables. So it's no longer just about bariatric surgery. And so we're seeing more and more patients coming through here that want to then address some of the issues that happen after their significant or massive weight loss. All right. So what are the options? What are your options after massive weight loss to improve your appearance, to improve the excess skin, to improve perhaps sometimes muscle weakness or separation, or all these things that are going to happen due to a prior obesity, okay? So massive weight loss, and when I'm talking here, I'm talking about weight loss regardless of how you do it, whether it's through diet and exercise, whether it's through bariatric surgery such as a gastric sleeve or a gastric bypass, or whether it is through the injectables like semaglutide, the Ozempic and the Mounjaro, okay? Regardless, after someone loses a significant amount of weight, they're going to have, unfortunately, they're going to have some side effects from that, which typically has to do with excess skin, okay? Either excess skin or weakness or separation of their muscles, okay? And unfortunately, there is no amount of exercise that is going to get rid of excess skin, all right? So I know there's sometimes some gym rats out there, some haters, and they're like, oh, you should just have, just do more exercise. Well, I'm sorry, but there's no amount of exercise that's going to deal with excess skin. What does exercise do? Yes, it makes you healthier. Yes, it can increase muscle mass, but it does nothing to tighten up the skin, okay? So let's take it from top to bottom, all right? And all this is going to, what exactly is it's like the best treatment for you is going to depend on how much skin laxity there is. And a lot of times how much skin laxity there is depends on several factors, a lot of which you can't control. So for example, age, right? If you lost the weight when you were in your 20s as opposed to your 50s or 60s, your skin has a better chance to bounce back. Another thing is that, did you have a lot of sun exposure? Were you a smoker? All these things are going to affect how well that skin bounces back, okay? So the one thing that you kind of have a little bit of control over, but not really, is how fast you lose the weight. So the faster you lose the weight, the more chance you're going to have a whole bunch of the hanging excess skin, because that skin's had really no chance to retract back, okay? So if it was ideal, you would probably lose the weight, say, spread out over a year as opposed to 3 months, okay? But let's say you've done that, you've done the great job, you've lost the weight by whatever means you have, and now you've left with some new skin in certain areas. And so starting from the top, in the face and the neck, all right, if you have a significant amount of excess skin, especially in the cheeks and the jowls, in the neck area, then you're probably going to need a surgical solution to that, and that's going to be either your facelift or your neck lift, or the combination of both. So a lot of facelifts actually combine both, so it's very common to have both a facelift and a neck lift done at the same time, and that's going to be your most extreme surgical option, okay? Now, there may be people where the face actually didn't do too bad. Maybe the abdomen did terrible, and you have a huge pannus and hanging skin, but the face is not looking too bad. So then you may have some other less invasive options. So the next less invasive option is actually this one here, which is what we call the face tight, which is a device that we can use. It's also done in the OR, but it's a device that we can use to really help that skin in that chin and neck area to give you a nicer, more acute angle between the neck and the chin. And so the face tight, tends to work really well for that. Typically, I recommend that for some of the younger patients who are not quite ready for their facelift or neck lift. It can kind of push the clock back and give them another good few 5 to 10 years before then they need that bigger surgery. Now, if it's something even less than that, then a lot of times that can be dealt with in the non-surgical space, which will be with your fillers, your hyaluronic acids, your Restylane, of course your Botox as needed, and What's really kind of taken off lately is the Morpheus, which is a device that has microneedling combined with RF energy or radio frequency energy. And that's what I like to call basically microneedling on steroids. I mean, it works really, really well. It's something that's done here in the clinic on just some local anesthetic cream that you put on beforehand. It's one of these kind of lunchtime procedures. And then, you do have to do 3 treatments though. That's the important thing to note. So you do your first treatment, and then 1 month later your second treatment, and then one month later your third treatment, and then you're done, okay? But that works really, really nicely as well. All right, so now we're moving down. Let's go down to the arms. That's typically the next area where you're going to see a lot of kind of loose hanging skin, especially this area here, what they sometimes call the bat wings. And so depending, again, on how much excess skin there is, it depends then what's the best treatment for you. So now if you have a very large amount of loose skin that gets really flopping around, then the best thing is going to be what's called an arm lift, okay? And so with an arm lift or a brachioplasty, we're literally cutting the excess skin out. It does leave a scar. The scar is going to go from about the elbow area all the way out to the armpit area. So it does leave a long scar. I like to put it in this area right here such that when your arm is down, it's not visible from the front and the back. But of course, if you raise your arm up, you're going to see that scar through there. Okay? For very, very few cases, but they're not many, but I've seen a couple where the skin's actually looking pretty good all the way till just about here, just underneath the armpit, and it just hangs there. So sometimes you can do what's called a mini arm lift, in which case you're tucking that incision into the armpit. So the incision is kind of like the crease of my shirt, like along the armpit through there, and it's not visible through here. And sometimes that works, but it's for very, very few, very special cases, okay? The next thing though is then a little bit less invasive is what we call the body tight. So similar to the face tight that we did here for the chin and the neck, the body tight is a device that uses radio frequency energy to help the skin retract. And that works well for mild to moderate cases of skin laxity for the arms, all right? So this is for mild to moderate. We can do the body type. We can do that at the same time as a lipo 360, BBL, or any other procedure really. Or, of course, if you have a severe amount of loose skin, then you're going to do your arm lift, all right? Okay, so then moving down for men, for the chest, a lot of times men that undergo rapid weight loss, they develop actually loose skin in the chest, or sometimes some excess fat in the chest that didn't go away completely. So depending on how much loose skin there is, you can actually have a gynecomastia surgery where there's excision. That means that we're actually removing the excess skin. Of course, that's going to leave a little bit more scarring. You're going to have a scar around the areola and sometimes down in that crease area between the chest and the upper abdomen, okay? And that's for the more severe cases of gynecomastia. If you have a little bit of a less severe case, so you have maybe mild to moderate excess skin and you have some excess fat or breast tissue, then probably the next best option is to do liposuction with the use of the Vaser. The Vaser works well in this area because it helps, number one, break through some of that more fibrous kind of breast-like tissue in the chest, and it also helps the skin retract. And that's why this becomes a good option for those more mild to moderate cases there without having to leave any large scars, okay? And of course for women, what's very, very common is that they lose a lot of volume in the breast, and of course the breast hangs low and the nipple position is pointing down, in which case you are definitely going to need a breast lift. And typically you do have to combine that with an implant because after the massive weight loss, you've lost all this volume, especially in that upper pole of the breast. So we got to give some volume back, and the best way to do that is with an implant. So with the breast, of course, you have the different options depending on exactly what you need. The most common option is a breast lift with implant, but then there are a few patients where they'll do okay with just a breast augmentation. There are a few patients where they lost weight everywhere else except the breast, in which case those patients will probably do well with the breast reduction and lift so that the breasts are now more aligned with the rest of their body, okay? So any of those options are there for the breast. As we keep moving down, now we're getting to the abdomen. This tends to be like the number one problematic area after a significant amount of weight loss. It's problematic because there's going to be excess skin. A lot of times that skin hangs all the way down, like into the thighs, close to the knees. That's what's called a pannus. And that really needs to be taken care of because not only is it an aesthetic thing, but it can also cause issues like a lot of moisture underneath, which can lead to infections. and hygiene issues and things of that nature. So it does become an issue. And you also, if you are, obese or had a lot of overweight or very obese, a lot of times the muscles also got stretched out, which means that there's also some weakness of the muscles or separation of the muscles, and that needs to be taken care of too. So the solution is a tummy tuck. Now, what type of a tummy tuck depends again on how much excess skin. The most common ones for massive weight loss are either your typical full tummy tuck, which is going to involve the removal of the excess skin, and of course that muscle plication or tightening underneath there. And then you may have your extended tummy tuck. That just means that the scar, that horizontal scar, extends out and kind of goes around the corner towards the back, okay, because we got to deal with some excess skin along the flank area as well. So that's going to be your extended tummy tuck. Or if you have a lot of excess skin, not only in this direction, but in this direction as well, then you're going to need what's called the fleur-de-lis, which is like your most aggressive type of tummy tuck, in which case you're not just having the incision that kind of goes across horizontally, but you're going to have a vertical incision too, as well, to be able to remove excess skin in this direction, okay? So that's the fleur-de-lis for like your really massive weight loss patients, all right? As we go around to the back, a lot of times when you lose a significant amount of weight, you have loose skin in the upper back area, kind of along that bra line area. And so a tummy tuck's not going to do anything for that, and a lower body lift is not going to do anything for that. So then you probably need what's called a bra line back lift. So the bra line back lift is what's going to deal with that excess tissue through there. It does leave a scar that goes all the way across the back, but we do try to place it just along that bra line so it's not visible if you're wearing a bra or clothing. But of course, outer clothing, you're going to have that scar that goes all the way across the back. But it's going to get rid of all that excess skin all in this area that tends to hang in that area, okay? Now, if more of the excess skin is kind of towards the bottom, then you can do a lower body lift, which sometimes really, it kind of comes combined with this, which is the next one I was going to talk about. So lower body lift and the buttock lift are basically a very similar incision along the back. It kind of goes, the incision kind of goes in the seagull type shape just above the buttock, and what it does is that it lifts the buttock up and it removes some of the excess skin in that lower back area. And so it's kind of a combination there where you can do those two things. And you're going to need that if you have excess skin here in the lower back, or if you have the buttock has become kind of saggy with a lot of excess skin and you want to lift that skin and remove that excess skin, you can do it there as well. So that is a true buttock lift, okay? That's a surgical buttock lift where you're removing the excess skin, and sometimes you're actually adding what's called an auto-augmentation, adding a little bit of extra tissue to the upper buttock to give some more fill there, and then you can combine that with a fat transfer to the lower buttock to really bring out a nicer shape and a fuller buttock. Now, not all patients need a surgical buttock lift. Some patients are able to do okay with just filling the area with volume, and so they're going to be a good candidate then for the BBL. All right, so this is where the evaluation comes into play, and I got to look at your photos and see what you're going to be the best candidate for. But yes, you can sometimes be okay with the BBL, in which case we'll do some liposuction, liposculpture, remove some of the excess fat, and then transfer that to the buttock and hips to create a nice fuller shape. Now, here's a caveat. For most patients that are doing okay with this, it's typically not best to do that as their first procedure. You want to do some of your other kind of surgical procedures first. Specifically, the tummy tuck is what I would highly recommend. Get your tummy tuck first, and then 3 to 4 months later, you can come back for your liposculpture and BBL. All right? If you've already had your BBL and you need some touch-up or tune-up procedures, then you can do that in the clinic setting, where we can sometimes add a little bit more volume to Sculptra. If you have cellulite, we can deal with that with the Abdomen. Or if you need just a touch more skin tightening, then we can also do Morpheus 8 to this area. Morpheus 8, remember, is that microneedling with RF energy, and we can really do that in any area. We can do it in the face, in the neck, the chest, the abdomen, pretty much anywhere. Anywhere you have some mild to perhaps a little bit more than mild, like low, moderate excess skin, well, that Morpheus 8 is going to work, and it does well, and like I said, in the clinic setting, so it's very easy to do. Okay? And then last but not least, then we get into the thighs. And so for the thighs, again, we have certain options depending on the degree of skin laxity. But if you have, say, mild to moderate skin laxity, then I think the body type works really well. So the same body type that we may have used for the arms, you can use that on the thighs. It uses that RF energy again to help with that skin retraction. We can do a little lipo if we have to remove some excess fat. And we can do that with little tiny stab incisions, which is why this is my preferred treatment for the thigh if we can do it, if we can get away with it, okay? However, if there's just a ton of excess skin on that thigh, like it's really hanging down, then we have got to look into your surgical options, which is going to be your thigh lift. And this can be done in two ways as well. There's your vertical thigh lift for the most severe cases, but that does mean that there's a scar pretty much from the knee to the groin. So a very long scar on the inside of the thigh there. Or sometimes if it's not so terrible, right? It's like more like moderate plus in terms of severity, then you can do what's called a medial thigh lift. And that thigh lift is where you're going to be placing the scar kind of tucked inside that groin area, so it's a more hidden scar there, okay? But not everyone qualifies for this medial thigh lift, all right? I know, if you had the choice, you're like, damn, Dr. Earl, I want a medial thigh lift. Well, you have to make sure that you're the right candidate for that procedure, okay? So we got to check on that, make sure that you're the right candidate. But if you are the right candidate, it's a great surgery in the sense that the scar is a lot more hidden when you do it in that medial thigh lift style as opposed to the vertical thigh lift, okay? All right, so those are all the options, lots and lots of options there. At the end of the day, what you need is an evaluation, right? You gotta basically fill out the form, send your photos, let us know what are the areas that bother you, and then we can provide some recommendations as to what's going to be the best course of treatment. Of course, if you have all of these things here, like you can't do that all at the same time, right? You can't do everything at the same time. You're going to have to stage it out. And so if you're someone that's lost 80 pounds or 100 pounds, really significant amount of weight, just prepare yourself for like multiple stages. You're going to need minimum 2 stages, maybe 3 to really get everything addressed, okay? All right, questions?
A lot of them, Doc.
Okay.
Oh, wow. Let's start with that.
Start with the first one.
Yes. Ok, en español. Porque hoy dijimos que hablamos español también.
Sí,
diferencia.
Ayer.
Entre lipo tradicional y lipo Vaser.
Bueno, la diferencia es el uso del Vaser. El Vaser es una máquina que usa la energía del ultrasonido, ¿ok? Y esta energía ayuda a remover más grasa de una manera con menos sangramiento, con menos inflamación, y también esa energía ayuda a que la piel se retraiga mejor. So, yo creo que esta es la mejor manera de hacer la liposcultura, y por eso todos mis casos que tienen que ver con liposucción, liposcultura, liposcultura de alta definición, todos esos casos van a llevar el uso del Vaser.
A lot of Spanish questions.
Oh, mucho español.
Yes, mucho español. I'm going one on one, okay?
Okay.
What's the age cutoff for BBL and mommy makeovers?
So for BBL, my age cutoff is 50 years old. Now I know a lot of people out there, then they get upset and they're like, what, 50? I'm still young, I'm still healthy. Well, that's really based on my personal experience. So I've done it over 2,000 ultrasound guided BBLs, probably over 3,000 BBLs in total. And that what I found is that a lot of patients that are over 50, they just don't get the results that they want because their skin doesn't retract well, and so they're much better off doing like a tummy tuck or some other skin tightening surgery. And also it's a big surgery with a lot of fluid shifts, and they don't tend to tolerate the surgery as well, and they may end up in the hospital needing some IV fluids or a transfusion. So for that reason, my cutoff age for BBL is now 50. But for the mommy makeover, it can be a little bit higher. Typically that cutoff is about 55. There aren't so many fluid shifts in that surgery. Everything's done under direct vision, so it's tolerated better up to the age of 55.
Is it possible to have an awake BBL?
It is by some people, but not by me. All right. I don't recommend that. I think it's very tough to really do this surgery thoroughly, and with the devices that we use, such as the Vaser and the body type, with a patient that's awake. It's really hard to really get enough numbing in there that the patient's not moving around, they're not squirming, they're not in pain, and so then the surgeon doesn't feel totally comfortable, and therefore the results are going to be less aggressive. They're going to be subpar, and so I don't recommend that. The other thing is that in order to do that, you have to put tumescent fluid with lidocaines, because the lidocaine is what causes the numbing. But you have to be very careful with how much lidocaine you can actually give a patient. If you overdo it, there is such a thing as a lidocaine toxicity, which can then affect the nervous system or the heart, and that can be very, very dangerous. So I totally eliminate that from the equation. I don't use any lidocaine at all, and therefore the chance of lidocaine toxicity falls to 0.
Okay, the 3 different person asked more or less the same is, do you remove fat from a previous BBL, or do you do BBL revisions?
Yeah, so that is something that we are seeing more and more now. We're kind of becoming known actually as one of the centers that really does this and does this well, because it's not easy surgeries. But yeah, we certainly take patients for BBL revisions, BBL reductions, or BBL reshapings, however you want to call it. Because usually it's not just an issue with reducing some of the volume, but it's changing the shape to something that looks more of an enhanced natural look, as opposed to like a very kind of exaggerated or surgical look, or something that just doesn't belong to your underlying foundation. So we kind of bring balance back to the patients, and that can be a combination, like I said, of revising things, reducing things, and reshaping things. But we certainly do that. We do have to have an evaluation to make sure that we're able to achieve your goals.
Okay, this is your patient Earl Remade. She said, "Hi doc, I'm 6 weeks today. Yay!"
All right, you made it to 6 weeks. That's a great landmark, because that means you can get back to normal life and start doing all your regular stuff.
And send us your pictures, please. I had bought implants which have been removed, but the pocket are still there. Can you perform a BBL on me?
So the implants are gone? Yeah. So if the implants are gone, then we should be able to do the BBL. Of course, I do all my BBLs under ultrasound guidance or ultrasound imaging. So I should be able to see, that space kind of that's between the skin and the pocket, to be able to place some of the excess fat there. Most, I'm not sure exactly your particular case, but most buttock implants are placed actually like within the muscle or underneath the muscle, which is a space that we should not be placing fat anyways, and we should be placing the fat above the muscle. So technically, yes, we should be able to then do the fat transfer above the muscle.
Does lipo or BBL cause cellulite?
So lipo or BBL does not actually cause cellulite. Okay, cellulite for the most part is genetic. It affects a lot of women. 9 out of 10 women have cellulite. Okay, but it can potentially be made more visible with a BBL, right? Because what is cellulite? So cellulite is an attachment. Okay, a fibrous septa is the technical term, but basically it's an attachment that attaches the skin to the underlying muscle, and it tethers that skin down. So if you add more fat around the area, then it looks like the dimple got worse, okay? Because now there's kind of more volume around, and that skin is still attached and being held down. But it didn't actually cause a cellulite. Now, the way to fix it is to then deal with those bands, and that's why the Abelli device works so well, because it directly affects the bands. It goes to the target, it cuts the bands, it releases that skin, and once that skin is released, it can pop back up and create a smoother contour.
Okay. She said my pockets of the previous implants were placed above the muscle. Just to let you know that. What are your thoughts on radio frequency and cavitation machines?
So I do like the use of them when there's necessary. I'm not one that has it like as routine, like every single patient that undergoes liposuction or BBL liposculpture needs to have this. But there are certain patients where they do need it and it works well. So for the rate of frequency, typically, or cavitation, you don't want to start to about 2 weeks post-op. But if you're one of these patients that needs it, then yes, go ahead and do it.
After BBL, how long can I sit?
So you're not going to be able to sit directly in the buttock for the first 6 weeks, okay? So after 6 weeks, you can sit normally. Within the first 6 weeks, you have to sit using a special pillow called the BBL pillow.
Okay. Do you do face fat transfer to the face? Sorry.
Yeah. So I don't do that myself. I don't do a lot in the face. I'm more like a body plastic surgeon, if you will. So I do from kind of from the chin down. But my partner here, Dr. Vidal, she does a lot of the facial procedures. She'll do the facelift, neck lift, blepharoplasties, rhinoplasties, and she can do some fat transfer to the face as well.
So, would you do a BBL on someone who needs a tummy tuck but's not done having kids yet?
So the answer is yes, as long as we have a very clear understanding, okay, that eventually you are going to need that tummy tuck, and that the belly is just not going to look the way that you're going to want it to, right? Because when you have the loose skin and you do the liposuction, okay, that skin's going to remain loose and it's going to look uneven. It's going to look lumpy, bumpy, and wavy, all right? And it's not because the liposuction is uneven, it's because the skin is uneven, okay? So as long as you understand that, and you're okay with it, then you can move forward. You can have your BBL, enjoy the better shape overall, enjoy the fuller hips, the fuller buttock, and then eventually you may have the other child. And then you just have to know that once you're done having kids, you're still going to need that tummy tuck.
Can you do chin and 360 lipo at the same time?
Yeah, you can definitely add the chin. So when you do the lipo 360, there's certain areas that are very common to add. One is the chin, the other one's the arms, and the third one is the thighs. Oh, also the axillary areas. Up in here and through here, we can add axillary areas as well.
When requesting a natural BBL, what's your call like? Do you add to the hip dips?
Yeah, so when you want what we call the enhanced natural BBL, that's kind of my signature style. We call it our South Beach butt lift, which is actually trademark. You can only get it here with me at Pure Plastic Surgery. And we're going for those enhanced natural shapes, right? Those shapes where you look more curvy, but everything really goes with the underlying foundation, nice smooth transitions, and it's the kind of shape where you look fantastic, but you keep people guessing, like, does she have surgery, does she not? I can't tell, but she looks great. That's really what we go for, and so when we do that, we typically fill in those hip dips, but to the point where it just creates that nice smooth curve, right? We're not over stuffing things with not too much volume. We want to make sure that the transition between the waist and then that nice curvy hip now and your thigh is done in a nice smooth fashion.
How soon can we schedule for next year, and how far apart do you need to be cleared?
So we open up our surgical schedule up to a year out. So if you wanted to schedule for 2025, you can do that now. You can do that up until June of 2025. So potentially, you have all that time to schedule your surgery. And I would recommend, just get started now. Just get that on the books, okay? Plus, you're going to have the best pricing right now because some of you have been following me for a while. You know that every January prices go up. So that's been happening for the past few years. It's probably going to happen again this year. So if you want to get the best possible price, you want to do that now before 2025 comes around the corner.
Can you still have children after liposuction?
Of course, yeah, you can have children after liposuction. It's definitely not a contraindication. It's not going to affect you in any way. And if you kind of have a controlled pregnancy, right, that you don't overdo it, you don't gain too much weight. I've seen a lot of our patients that have had their lipo 360s or BBLs, and they've gotten pregnant, have their child, and then they then after having the kid, they get into their nutrition and physical exercise, and their body bounces right back to what it was, before getting pregnant.
Okay. Can we talk about dog ears, please? Can those be done under local?
Definitely. So, well, first of all, we want to try to avoid dog ears. Okay, so we work really, really hard on our tummy tucks to try to do everything that we can to avoid them. And what does that mean? That means extending the excision as far as we need to go, and also doing liposuction to that area as well. And when you do that, you're not going to completely eliminate, but you very much minimize the risk of getting a dog ear in the first place. And the second thing is, well, if you develop a dog ear, when we do all that, typically it's a very small dog ear, which, yes, definitely you can take care of that under local very, very quickly, very easily.
Okay, and the last one, Doc. Can we
Uh-huh.
also talk about how to identify infections versus spitting sutures?
How to identify infections
Versus
versus a spitting suture? Okay. Well, sometimes it kind of comes a little bit together. When the suture starts to spit out, you can get like irritated and inflamed. You can get like a small, little, tiny localized infection there. What tells you? I mean, if it's just a suture popping out and you see nothing else, like no drainage or anything else, then perhaps it's just a stitch, and you just have to cut that stitch, remove it, and then you'll be okay. But a lot of times it comes with a little bit of redness around the area. That's the first thing you're going to see, is a little bit of redness. And the next thing you're going to see is probably perhaps a little bit of drainage, which can be more clear, or it can be a little bit more thick, a little bit more purulent. And so when you see that, that's really more of a sign of an infection, with or without the spitting suture. And so what is the solution? Well, if it's due to a spitting suture, then one of the things you definitely have to do is remove that suture. All right, because things are not going to heal until that suture is removed. So if you see a suture kind of poking out, make sure that it is removed. Once the suture is removed, then for most of these cases, the treatment is simply a local antibiotic ointment, which can be like mupirocin, bacitracin, or Silvadene. And usually with that, eventually the little localized infection goes away and it heals up and you're good to go. There are some patients where we may then add some oral antibiotics. One of the most common ones that we add is called doxycycline. So that's a possibility, okay? And this will be extremely rare, much less than 1%. But if it becomes something where the infection is a little bit more severe, then sometimes we have to do some IV antibiotics. But like I said, that almost never happens. All right. Okay, everybody. Well, I think that's a wrap. I hope everybody got a screenshot here of all the possible kind of things that you could potentially do after your weight loss journey. And again, if you really want to know what's going to be the best kind of plan tailored for you, because every patient is unique. Nobody loses the same amount of weight. Nobody loses the weight in the same way. Nobody's skin is the same. So every patient is different. And so we have to come up with a unique plan for you. And so the best way to do that is to get an evaluation. Go ahead and send us your questionnaire and send us your photos, and then we can provide you the feedback, what's going to be the best recommendation for you, how many stages you're going to need, and in what order for the best long-term results. All right? Okay, everybody. Well, that's going to be it for today. But I look forward to seeing all of you next week on Hump Day with Dr. Alex Earl. I'll see you all then. Ciao.